Some of the symptoms of stress that we see when people come into our office, you should always be watching them carefully and listening to them carefully and observing for physical signs of maybe stress or possibly even shock. If people look completely disoriented, distracted, and while they're doing their history intake, and I'm listening, keep trying to tell them, you've come to the right place, we're going to work together, da-da-da-da-da. I'm not coaching them much. I'm just listening if they feel like they need to talk. If they need to talk for 30 minutes, they talk for 30 minutes. But if I see that they are too disoriented, too distracted, I get them on the therapy table. I typically will take a light blanket and put on their back and tuck them in a little bit at the side. It gives them that womb-like a feeling. There's just something psychological about that, something warming and caring about that. Typically what I like to start with is a technique that I start every session with anyway, because I like to look the people in the eye and chat them up, normally get to know them, how's the family, da-da-da-da-da-da, and you need to look at them, communicate, get that bonding, because half of the therapeutic value is going to come from how well they receive you, how your touch feels and how well they receive you, how your office looks. And you got to treat them like they're the most important person in the world the whole time they're in there. I come in, my left hand, put it on Terry's forehead, and then I'm just going to come around and do a slow draping, just relax, and I'm just going to slowly drape up the side of her suboccipitals, really, really slowly. I'm catching the medial border of the rectus capitis posterior minor and going all the way over to the mastoid process. Sweep all the way over there, catching splenius capitis, that little bitty edge of splenius capitis there that attaches right under mastoid process, right under sternocleidomastoid muscle. So I just slowly sweep over there, and I'm still looking at them. I'm observing for them. I'm not staring at them, but I'm observing and pleasant, seeing if they're looking at me. A lot of times when they're in shock, they will not. They either have blurry eyes, they're looking at you, but they're not looking at you, or they won't orient. They won't orient at all. So I'm still watching her, but this time I'm just going to do a simple sweeping up. You guys all do this. Sweeping up the lateral sides, posterior lateral sides of the neck, all the way up to the suboccipitals. When you get up the suboccipitals, just traction and hold. So I'm just leaning back, tractioning and holding, soft, flat finger pads. I like to do this because it's something that seems to calm them down a lot. I put the neck into head, neck into flexion, and I come in with my soft thumb pads right at rectus capitis posterior minor in the middle. And I'm just going to hold and distract a little bit of distraction. Just holding there. After a while, I'll move laterally. I'm doing this a little quicker than I would in session, because sometimes I'll do an entire neck session on the person that's in stress. I also like to do a corkscrew, which is actually a technique for splenius capitis, splenius cervicis. We use it for many, many different things, and it's been around for decades and decades. People have taught corkscrew. Just taking the thumb, gliding it along just in front of the trapezius muscles on each side. And so as I side bend, rotate her head to the left, that's when I glide down. So left and right, because this just feels good. A little bit of rocking motion, give them a little bit of the rocking motion. Back and forth, back and forth, back and forth. We'll just give the movement cue to Terry. Please just gently tuck your chin toward your chest. And when she does, and keep your head on the table, there you go. And then I just try to create more double chins, which I know you'll appreciate that. Okay, tuck. So now I'm just enhancing it with 2 seconds of overpressure. She does the tucking, I follow with 2 seconds of overpressure to try to glide that head back into flexion. Head on neck into flexion, because in the forward head posture, what happens? Everything starts going forward, the head has to cock back to level the eyes, law of writing, right? And so that's where they have problems. Coming in like that, I checked her going back, and now I'm checking her going forward into flexion, seeing if these condyles here, these things right here, will glide back. Now we have to check if they'll glide side to side, front to back, then side to side. And then we're going to want to be able to make sure that the atlas on axis is rotating. It's supposed to rotate what? 45 degrees each direction, a total of 90 degrees of head rotation through there. And now I'm going to do what we call the alternate OA technique. And so basically what I'm doing here is I'm going to come up on this transverse process here, and notice how it opens this condyle on this side when I push on here. So I'm going to come up, I'm going to lean to the left, pull up on it, and open that condyle. Lean to the other side, open that condyle. Make sure it's opening side to side. Has to be opening like this, side to side. And then we'll do atlas axis, the rotation component. So here we go. This is simple. You come, first just start at the suboccipitals, the lateral border of the suboccipitals. Rectus capus posterior major is fine. And then just side to side, I come in, and first of all, I'm just doing suboccipital work, still thinking about calming that nervous system down. And then I want to get a little bit more serious about what I'm doing here. And so I start moving the fingers till I get over here on this bump here, which is the transverse process of atlas on both sides. And then I come over, back and forth, pulling up here on the lateral fascia, pulling up here and opening the opposite side, or seeing if it'll open. She's pretty even, and I don't even coach the people or talk to them about it during this kind of session. A stress session, I don't talk about it. I'm just trying to get some lubrication in there, get some WD-40 working in there, or hyaluronic acid, or glycosamine glycans, GAGs. Okay, so atlas axis is a bunch of ways to do it. I do it standing a lot, but this is going to be a real simple way. I'm just going to come over here, and I'm just going to come in with my finger right here on this bone right here, the big old transverse process, and I'm going to turn her head and make sure that it will rotate. So here we go. Just once you get in here and do this a few times, you'll be able to identify that big old transverse process. It's right under the mastoid. It's just right under there. And on some people, you can't really feel it because they have a real muscular neck or something like that. Just fake it. Get in there, because if you're near it, you can affect it. As long as you're on the posterior side and pushing the tissue that direction while you turn the head, very, very therapeutic. After each one of these things, I decompress. So I have this decompressive force. Now I'm just shrug your shoulders toward your ear slowly, and down, and up, and down. And then just rub a little bit, make them. They're now more relaxed. You can move a little bit more quickly through the tissue now because they're feeling a lot better. Of course, you're still looking at the face, watching for signs of still having jittery eyes. Are they focused? Do they still seem disoriented? Do they still seem distracted? The last thing I'm going to do is closing stretches, which we do this on. I do this is how I close each session. I'm going to get low. Typically, I have the table up. Matter of fact, I think I will put the table up just a little bit on this. Decompress. Now I'm going to come under. You guys all are doing this already because we teach it in every single workshop for the last 20 years or so. My right hand comes under and drapes the anterior part of this shoulder, and my non-dominant hand comes under. I get my body weight low, center of gravity low, And I push on the shoulders rather than cranking on the neck and bringing the head neck into flexion. So I'm pushing down on the shoulders. You don't want to be cranking on the neck. And you also need to tell them if there's any pain with any of these techniques, that you want them to let you know right away, because you don't want to take them into an area that's painful. It'll stimulate that hyperexcitability in their sympathetic nervous system again. You don't want to fire them back up. You just calmed them down. Okay, so this is coming off. And then I'm going to come over here to the left and just give it a mild, gentle stretch. I'm not trying to get a bunch of range of motion or anything right now. This is just supposed to feel good. And notice how I'm just rocking her neck over my forearm. And I can cross over if I want to get an extra stretch. And then I come back and I want to do the opposite side. So now I'm going to roll her again just to this side to stretch this. Notice how I'm pushing, depressing here to get a counterforce. And now 3 big circles. 1, 2, 3. And I'm going to come in here, this hand now, and I'm side bending her left, rotating her head right, and I'm just going to push on that shoulder. Going to the other side, switch hands. Side bend right, rotate left, and just stretch the lateral part of the neck. This gets out all of the major muscles of the neck, this little technique. And decompress, decompress, decompress. Typically I'll have them grab my wrist and do a whole body stretch or something like that, but not always. Keep in contact with your person, make them feel safe, make them feel heard, and you'll get rid of a lot of this hyperactivity of the sympathetic nervous system. Okay? We'll see you next week on Technique of the Week.